Good day! I am Marnel Riniopa, BSN 1B, your student nurse from Medical Colleges of Northern Philippines. So for today, I'm going to assess the neurological, the musculoskeletal, and peripheral vascular system. So, good day! I am Marnel Riniopa, your student nurse for today from Medical Colleges of Northern Philippines. So, for verification, ma'am, may I know your full name? Your age, ma'am? Your birthday, ma'am? Okay, ma'am Higdal. So, ma'am, today I will be checking your neurological, which is to identify any abnormalities that may affect functions and activities of daily life. The musculoskeletal, which is to help to identify the functional anatomy associated with clinical conditions, and the peripheral, which is to discover signs of pathology in the peripheral vascular system. So next is instruct the patients to void and to collect a urine specimen if ordered. So next is to perform hand hygiene. So next is to assist the patients undress if needed, and to assist the patients to a sitting position. Since my patients are in lab gown and she is in sitting positions, I will be proceed to assess her mental status. So ma'am, so now we are going to assess your mental status, ma'am. So can you answer these following questions, ma'am? Okay, ma'am, where are we now, ma'am? What time is it, ma'am? Do you feel dizzy right now, ma'am? Do you feel any pain right now? Okay, who is the President of the Philippines, ma'am? Okay, can you tell me your explanation about this proverb? The early bird catches the worm.
Something to early to maximize potential outcome.
Okay, ma'am. So next, ma'am, kindly repeat after me. Okay, 10, 20, 30, 18, 19, 22. Okay, ma'am. So next, ma'am, is babaliktarin mo. Yung huli kong sasabihin, ma'am, is yung una mong sasabihin. Gets mo ba, ma'am? Okay. 9, 18, 12. Okay, ma'am. So next, we will proceed assessing the cranial nerve 1, which is the olfactory. So, ma'am, first is I want you to sneeze for this assessment. After, ma'am, itapon mo na lang dyan sa basurahan. Okay. Ma'am, we do that, ma'am, for us to check if your nasal passages are clear. So next, ma'am, since, ma'am, this is olfactory nerve, I want you to close your both eyes and occlude one nostril. And I want you to identify the smell of this substance. Okay, what smell, ma'am? Okay. You can open your eyes now, ma'am. Okay, that's very good. Coffee. My patient has normal olfactory nerve because she identified the correct smell of the substance. But if you encounter a patient with inability of smell, the patient has nausea. Okay. Next is to assist the optic nerve, which is to check the visual acuity on how the person can see the detail of a letter or a symbol from a specific distance. So, ma'am, maaari ka po bang tumayo dyan? And then, basahin mo, ma'am, top to bottom. Okay, 1, 2, 3, go. You can read it now, ma'am. Ma'am, wait pala. Ma'am, dapat po, cover po yung right eye. Right eye cover, ma'am. Okay, you can read it now, ma'am.
E, F, G, D, O, Z, M, A, D, A, E, C, F, D, P, D, S, E, G, D, F, E, F, O, P, D, Q, R, S, T, U, V, W, X, Y, Z, E, F, O, G, P, C, D, F, D, P, F, D, C, E, O, P, E, Z, O, L, C, F, T, D.
Okay, 20/20, which is normal, ma'am. Okay, next, ma'am, is cover your left eye, then read bottom to top. Okay, you can read it now, ma'am.
A, T, F, C, F, O, Z, T, F, D, D, F, D, C, E, O, P, C, D, D, O, F, P, W, D, F, P, O, P, C, D, Z, P, O, L, P, F, T, D, F, C, D, F, C, E, D, F, B, E, D, Z, O, D, F, B.
Okay, ma'am. 20/20, which is normal. So, you can read it both of your eyes, ma'am, from top to bottom again. You can read it now, ma'am.
E, F, D, C, F, D, A, D, F, C, D, D, F, E, E, F, O, G, P, C, D, F, D, P, L, D, C, E, O, P, E, Z, O, L, Z, O, P.
Okay, ma'am. Maaari ka na pong umpo. Okay, ma'am. Perfect. So, your both eye is 20/20 and that's normal. And also, ma'am, it indicates that you are having a normal eyesight. So, next, we need to test the visual field. So, Ma'am Hazel, all I want you to do is to say yes if you seen this object. It is okay with you, ma'am? Okay, ma'am, can you cover your right eye? Okay, do you see this, ma'am? This spot? This spot? Okay, cover your left eye, ma'am. Do you see this? Do you see this, ma'am? Yes. Okay, ma'am. So, okay na po. So, of course, ma'am, when looking straight ahead, the client can see object in the periphery. So, temporarily, peripheral object can be seen at right angle, which is 90 degrees to the central point of the visions. And the upward field of the patients of vision normally 50 degrees because the orbital ridge is in the way, and the downward field vision is normally 70 degrees because the cheekbones is in the way, and the nasal field of visions normally 50 degrees, which is from the central point of vision because the nose is in the way. That's clear po, ma'am? Okay po. So next, ma'am, is I'm going to assess the oculomotor, the truncular, and the abducens nerve. So first is I'm going to inspect the positions of your eyelids and your pupil. So ma'am, can you look at me and I'm going to inspect your pupil and your eyelids. Look at me, ma'am, please. Okay, as I can see, her eyelids did not obscure the visions, and the pupil of the patients are both round and equal in size. So, next is to test the pupillary reaction of the patients. Of course, Ma'am Hazel, I will be using this pen light, and I want you to focus on me, okay? Focus on me, ma'am. Okay. Ma'am, it's constricted, which is normal. Of course, ma'am, for direct response of her pupils, which is normal, and for the consensual response, the other pupil even without light. Okay, next is third is for the pupil dilation. So of course, ma'am, we have to assess the constriction a while ago. So now we'll be assessing the dilation. So first, ma'am, I want you to focus on this one. Focus lang, ma'am, ha? Okay, so the normal findings is as I move my fingers further the visions of the patients, so her pupil dilated, which is normal. So lastly, we will be checking for the extraocular movements for us to determine her eye alignment and coordination. So, okay, Ma'am Hazel, right now I want you to stand and I want you to follow this object, ganito ka pa, Ma'am, without moving your head. Okay, maaari ka nang po. So, that assessment, my patients, is normal. So, next is I'm going to assess your trigeminal nerve. And the test is sensation of pain and the temperature on the facial skin. So, first, let's test the pain of the patient. So, ma'am, I will be using this. Concentric applications in your face to assess your pain. So, ma'am, close your eyes. Okay, do you feel any pain, ma'am? Okay, to right side. Do you feel any pain, ma'am? Okay, my patient didn't feel any pain. So, next is, I want you to tell me if you close your eyes, ma'am. I want you to tell me if you feel this thing I put in your face, ma'am. Do you feel, ma'am? Okay. Now, ma'am, tell me where did I put the thing? Okay. Okay, ma'am. Okay, ma'am. That's good that you have identified the areas correctly because it means that your reflex is just good and your trigeminal nerve is functioning well. So next, ma'am, I'll be using this cotton again, but I will be checking your corneal reflex using this cotton. Okay, ma'am, can you please see the ceiling? Starting this side. Do you feel any pain, ma'am? Do you feel any pain, ma'am? Okay, so my patient trigeminal nerve is normal. Next is, I'm going to assess the facial nerve of the patient. So, ma'am, for this assessment, ma'am, I want you to stand up and I want you to follow me, okay? Ma'am, I want you to give me a smile. Okay. Ma'am, dito pa tayo, parang dito pa tayo. Show me your teeth. Okay. Can you frown for me? Okay, very good, ma'am. Can you puff your cheeks? Okay. Ba't natatawa ka, ma'am? Okay. Can you raise your eyebrow? Okay, very good. Upo ka na po, ma'am. Ma'am, can I touch your face? Okay. My patient has normal facial nerve because she can do facial expressions easily. But if you encounter the patient with which muscle on one side is becoming a weak or become a paralyzed, she or he experiencing Bell palsy. So next, I'm going to assess the vestibulocochlear nerves for us to determine if the patient has a normal hearing and balance. So of course, first we need to assess for hearing. And of course, ma'am, I want you to sit here. Okay, ma'am. It is okay, ma'am, if I will cover your ear. Okay. I want you to repeat the word that I will be whispering. Is that okay with you, ma'am? Okay. Okay, so if your patients identified 3/6 whispered words, that is considered normal or passing the test. So second, we are going to assess for the lateralizations by performing the Weber test. So in this procedure, ma'am, I will using this tuning fork in this Weber test, ma'am, I want you to tell me if you feel or if you hear the buzzing from the tuning fork in both of your ears, and if you can feel the buzzing in your mid-head. Is that okay with you, ma'am? Okay. Tuning fork is like this. So, ma'am, saan mo pa narinig yung sound? Sa left ear mo ba or sa right ear? Okay. So, normally, sounds here in both ears or is localized at the center of the head or in indications forever negative. So, lastly, we will be performing the read test for us to compare air and bone conductions and to assess for hearing loss. So, a while ago, ma'am, we have performed a Weber test. So now, ma'am, we will be performing a ring test. So in this procedure, ma'am, I want you to tell me or to compare which sounds is heard louder. Part A ba or the part B? Okay? Okay, ma'am, part A ba or part B? Okay, so of course, normally, air-conducted hearing is greater than bone-conducted hearing. So next, we are going to assess the glossopharyngeal and vagus nerve. So ma'am, dito ka ma'am. Upo ka po dito. So, for us to check the positions of uvula, to check the gag reflex and swallowing reflexes, and to test the posterior third of tongue for taste. And of course, both cranial nerve are tested in common since they are both innervate the muscles of throat and mouth. Ma'am, can you say ah? Okay, ma'am, can you say ah? Other ah. Okay, it is not hoarse and it doesn't have nasal quality, which is normal. So second, let us observe the soft palates and the uvula. Okay, ma'am, I want you to open your mouth again for me, please. Okay, so my patient's soft palate rise promptly and symmetrically, and the ovular remaining in the midline. Next, let's inspect the anterior viewer and posterior pillars and fabrics. Can you open your mouth again for me, ma'am? Okay. Can you stick out your tongue, ma'am? Okay. Next is to... Okay. It is normal. Okay. Next is to test the gag reflex one side at a time. So, ma'am, so in this assessment for the gag reflex, we are going to use this wooden tongue depressor, and I'm going to stick this one in your mouth, ma'am. Okay? Okay po ba, ma'am? Okay lang po. So, okay, ma'am? Wider. Okay. As you can see, earlier, my patient has normal gag reflex, and of course, can you swallow, ma'am? Swallow. Oh, and of course, you can see my patient has a normal swallowing reflexes. So next is I'm going to assess the accessory nerve for us to check the strength of the sternocleidomastoid and trapezoid muscle by asking the patient to cervitate his head and shrug shoulder against resistance. Ma'am, harap po tayo dito. Shrug your shoulder, ma'am. Okay. Can you a little bit pressure po? Okay. Next, ma'am, is I'm going to test your head. Okay? Turn to the right. Turn to the left. Okay. So, muscle characterized by rating 1 to 5 and classifications from paralysis to normal, as you can see. So, ma'am, this is the last assessment about the cranial nerves. So, I will be assessing the hypoglossal nerve for any deviations and position. So, first, we need to ask the patient to open his mouth. Can you open your mouth again, ma'am? Okay, harap ka po. Open your mouth, ma'am. Wider, ma'am. Okay, as I can see, here, her tongue her tongue is free from atrophy and fasciculations. So, can you open again, ma'am, and stick out your tongue? Wider po. Okay, as I can see, her tongue protrudes straight out and free from symmetry and deviations from midline. So, after assessing the last cranial nerve, let's proceed to the next step. So, ma'am, can you turn your head side to side? Okay. How about put your chin on your chest? Okay. Move your head to the one side of your body. To the other side. Okay. Then look up to the ceiling, ma'am. Okay. Did you feel any pain, ma'am, while doing the procedure? Okay, that's great, ma'am. Your neck movement, ma'am, is normal, smooth, and controlled. No muscle spasm that may cause stiff neck. So next is, I will inspect the upper extremities of the patients for skin color, presence of lesions, rashes, and muscle mass. Palpate for skin temperature, textures, and presence of masses. So, ma'am, can you tanggal po? Pakitanggal po. Pakitanggal po itong ma'am. Okay, so as I observed po, both extremities of the patients are equal in size, have the same contour with prominence of joint, no involuntary movement, no presence of edema, no presence of lesions, and no presence of rashes. Temperature is warm and even, which is normal, and your color, ma'am, is even. So next is, I will ask the patients to extend arm forward and then rapidly turn palm up and down. Ma'am, can you extend your arm? Up po, then down. Okay, can you do it, ma'am? Again. Nahihirapan ka po ba, ma'am? So, the patient has no relatively difficulties has she performed, and also she performed with relatively ease. So, ask the patient to flex upper arm and resist examiner opposing force. So, ma'am, can you, okay? Then, push me, ma'am, as much as you can go. Okay. So, wala naman po akong nakitang problema. Na-reflex naman po niya yung arm niya habang po pinipigilan ko siya, which is normal naman po. So next is inspect and palpate hands, finger, wrist, and elbow joints. Okay, palpate na po natin, ha? Do you feel any pain now? any pain, ma'am? Sa wrist po? Do you feel any pain, ma'am? Okay. Sa joint po? Okay, as I inspecting and palpating, I observe that there is no any signs of lumps, lesions, rashes, which is normal. Next is I'm going to palpate the radial and bronchial pulse. Okay, as I palpate the radial pulse and bronchial pulse, I can say that is 2+, which is normal. So next is have the patient squeeze 2 of your fingers. Ma'am, can you squeeze my 2 fingers po? Okay. Wala naman po akong nakitang problema. So, normal naman po yung pag-squeeze niya. So next is ask the patient to close his or her eyes using your finger or applicator. Trace 1-digit number on the patient palm and ask him or her to identify the number. Then repeat it to the other hand with different number. Ma'am, can you close your eyes po? Ma'am, and I want you to identify the number that I'll be writing to your hand. Okay? Okay, very good. Okay. Open na po. Very good, ma'am. That it's normal because she identified the correct number. So next is ask again the patient to close his or her eyes. Place a familiar object such as key in the patient's hand and ask him to identify the object. Then repeat it to the other hand. So ma'am, can you close your eyes again for me? Then, I want you to identify this, ma'am. Okay? Sa left hand mo po. Ano po yan? Okay, very good. Okay, dyan po. Okay. Remote po to ng okay. Open na po, ma'am. It seems, ma'am, that you have good response, ma'am, because you got the correct name of the object that I put in your palm of your hand. So, next is assess the patient to a supine position. Examine the lower extremities. Inspect the legs and foot color, lesions, varicosities, hair growth, nail growth, edema, and muscle mass. So, ma'am, can you stand up? Then, i-ask po kita, ma'am, sa supine position. So, higa ka na po, ma'am. Okay. So, I will inspect na. Okay, extremities are traumatic in appearance po, without tenderness or deformity, no presence of lesions, no presence of edema, and no presence of muscle mass. So, I don't see any signs of discoloration po, and I don't see any abnormalities, which is normal po. So, next is test for pitting edema in the pretibial area by pressing fingers into the skin of the pretibial area. If unintentions remain in the skin after the finger have been lifted, pitting edema is present. Okay, as I observe po, there is no presence of edema. So next is I will palpate for pulses and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. So ma'am, can you sit po? So I will inspect the I will palpate the popliteal, okay po. Okay, the dorsalis pedis po. Po. And the posterior tibial. Okay. Okay po. The patient skin temperature is warm and even, which is normal. Then as I palpate the posterior tibial, dorsalis pedis, and popliteal area is 2+, which is normal. Then, ma'am, higa ka po ulit. Okay, ilang po? Okay. So next, have the patient perform the straight leg test with one leg at a time. So ma'am, can you perform one leg? Straight mo po yung leg mo. Okay, higher po. Okay. As I observe, okay naman po yung straight niya, wala naman po akong nakitang abnormalities, and also hindi ko naman siya nakitang nahirapan, which is normal po. So next, ask the patient to move one leg laterally with the knees straight to test abductions, to medially to test adductions of the hips. So ma'am, i-move mo po yung isang leg mo, tapos naka-straight po, okay? The other side po, ma'am. Okay, the patient range of motion is normal because she performed with relative ease. Hindi naman siya nahirapan at nakita ko naman po na normal po. So next is, ask the patients to raise the thigh against the resistance of your hand. So ma'am, i-raise mo po yung thigh mo. Okay, so next po. Okay, as I observe po yung patient ko po is kaya niya pong itaas yung thigh niya kahit po nakahawak ako dito sa legs niya, which is normal naman po, hindi naman siya nahirapan. So next is assess the patient deep down reflex. Then so I will use this reflex hammer. So first is, ma'am, can you sit down po? Okay po. Okay. Yan po. So first, I will place fingers above the patient wrist and tap with a reflex hammer, then repeat to the other arm. Okay. Okay, next is place your fingers over the antecubital area and tap with a reflex hammer. Okay. Next is place your finger over the tricep tendons area. Tap with the hammer. So, dito po, dito. So, next is tap just below the patella with a reflex hammer. Dito po. Ito po sa may ano. Okay. Next is to tap over the Achilles tendon area with reflex hammer again. Ito po. Okay. Wala naman po akong nakitang abnormalities, which is normal naman po. So, next is stroke the sole of the patient's foot with the end of a reflex hammer or other hard object such as key. Okay. 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 Next po is ask the patient to dorsiflex and plantar flex both feet against opposing resistance. Ganon po. Okay, yung isa po. Okay. As I observe po, normal naman po yung pag-flex niya ng foot niya, which is okay naman siya, hindi naman po siya nahirapan. So, next is as needed, assist the patients to a stand position. Observe the patient as she or he walks with regular. Ma'am, mag-walk ka po. Doon po tayo. Mag-walk ka po, yung normal walk po. Then, babalik po. Ganun po. Okay? Start po. 1, 2, go po. Walk po. Yung normal po, ha? Okay. Next is on the toes po. Ganun po. Toes. Ganyan po. Walk pa po. Toes po. Then, sa heel po. Heel po, ganun. O, walk po. Ganun po. Then, next po is heel to. Heel to. Heel to. Okay po? Heel to. Heel to. Heel to. Okay. So, next is So, next is perform the Romberg test. Ask the patient to straight po. Then, feet together po, ma'am. Then, both eyes are closed. Lang po, ha. Both eyes are closed. And then po, observe ko po kung ano. Okay. Okay na po, ma'am. Okay na po, ma'am. Okay na po. So, my patient is normal because she is able to maintain the balance with her eyes closed. So, next is assist the patient to a comfortable position. So, ma'am, assist na po kita sa comfortable po. Ma'am, comfortable ka na po ba? Okay na po? Wala ka na po bang tanong? Then, after that, record the findings. So, I will record the findings of this assessment. Then, after that, we will perform hand hygiene. So, that's all for this assessment, ma'am. Thank you for your cooperation, ma'am. Any question po, ma'am? Okay, don't you worry, ma'am. Your findings is all normal po, and na-record ko na po, and ipapakita ko na lang po sa physicians. Okay po, ma'am? Thank you, ma'am. So that's all for today's assessment. I hope you enjoy watching and learn something. Keep safe, everyone. God bless.